Howdy, and welcome to the Highline Herd podcast, where stories ride strong and the bond between folks and their horses runs deep. Each Sunday, we're talking everything from trail tips and tack to good old horse sense and the people who live it every day. Keep up with the herd by following us over on Instagram at the Highline Herd and swinging by our website at thehighlineherd.com. Now, let's ride into today's episode. Hello, and welcome to another episode of the Highline Herd. I'm Skylar.
I'm Shelby.
And today we are going to be talking about something that is very, very, very important. Equine first aid.
Yep, we're going to cover when do you call the vet? When can you handle it yourself? Now, without visual aids, that might be kind of hard for us to explain, but we will assure you at this. Better safe than sorry. Call the vet.
Yes.
You'll probably hear that a lot in this episode.
Yeah, no. That's something that we are going to repeat because it is very important. A lot of the times I've heard like horror stories of them not calling their vet when it was something that their vet would be able to help them with right away, and it ended up making the injury worse or resulting in the horse's death.
Yeah. Remember, your vet can look at a wound and tell you if it needs stitches. Your vet can look at a wound and tell you what is the best course to care for that wound.
Yep.
Is it a wound that should stay dry? Is it a wound you need to keep moist for a while? Does it need stitches? More often than not, your vet is going to prescribe you pain meds for your horse.
Oh, yeah.
And antibiotics.
Yep.
When my horse had to get 14 stitches in his back leg, she first x-rayed it because there was a risk of a fractured bone or a broken bone. And she also gave him antibiotics. We had no reason to suspect that the wound was absolutely disgusting, but it was let's just err on the side of caution because of the kind of wound it is.
And a preventative, too.
Absolutely.
So, yeah. It's very important to also pay attention to what your vet says when you do reach out and ask questions about a wound or injury, etc. Because they went to school for this. They know what they're doing for the most part. And if you trust your vet, they're going to try to do everything that they can to make sure your horse is okay.
And here's the other thing, too. This is something I've been seeing a little bit on social media. Now, we can't trust everything. There's multiple sides to every story.
Mm-hmm.
But if you are contacting your vet with an emergency, and it is paired with pictures and a list of symptoms, and your vet is not answering you, your vet is not responding to you, your vet is putting you on hold, get a different vet.
Yes.
Contact a new vet, get a different vet, do something.
Yep.
Because waiting for your vet to respond in certain situations will ultimately result in the death of your horse or unnecessary suffering.
Yes. Well, and another thing, too, is also keep in mind, vets are people, just like us. They have lives outside of their work. But 9 times out of 10, if you reach out to your vet outside of hours, if they are a really good vet and they do really care, they will answer you and be like, listen, I can't talk to you right now. Do this just for now until the morning. Call me first thing. That's typically what I get in response.
Or, this is why having a trailer is important. This is why knowing how to haul, having the ability to haul, having someone to call to haul is so crucial. Because, like Skylar said, vets are human. Yeah. They need to sleep. They need to eat. They're going to have multiple patients.
They have families sometimes. Yeah.
So, they may have another emergency they're handling. Always have a backup vet. Mm-hmm. And 2, always have a way to haul your horse to the vet if you can.
Yes. There are typically a bunch of emergency clinics that are open all hours of the day.
Around us, we have OSU and Rood and Riddle. Yeah. And I would haul to OSU in a heartbeat. They're fantastic.
Yes, they are amazing.
But it's about being prepared and knowing when to say, nope, we gotta do this. We have to get a vet involved. Yeah. And either try and contact your vet or just go ahead and call the emergency clinic ahead of time and say, hey, I'm on my way with this, this, and this. So they can be ready to greet you at the door.
Yep. Yeah, keeping your vet as informed as possible is a very, very good thing to do, because not only will it help them diagnose what's going on with your horse and figure out a treatment plan, but it could save you time and energy that the vet has to investigate and figure out exactly what's going on. So pictures, videos, all of that will help in the long term.
Absolutely. And always, always, always make note of things like heart rate and temperature.
Yes.
Hydration, waste output. Because when your horse is in pain, even if it's an injury to the leg or the shoulder, they can still, some horses are super sensitive. They can still develop gut issues from that. There are some horses that will absolutely colic because they are in so much physical pain.
Yeah.
And you do not want that.
No, it's not fun. It's not fun to see and be around.
Yeah. So, we just wanted to start our episode with vets. Like, this episode, yes, we want to inform you and educate you, but we also want you to understand we're not saying handle everything on your own.
Yeah.
We want you to understand that we understand, yes, the vet is expensive. Yes, sometimes the bills they give us seem outrageous. But at the end of the day, it is better to be safe than sorry.
Yes, it's a necessary part of owning horses.
It is. If there's swelling that won't go down, redness that will not go away, call your vet.
Yes. They're trained to and equipped to deal with situations like that. So they know what to do.
And some horses are squirrely. Your vet can sedate them. You can't.
Yeah.
I know some of us are lucky enough to have things like Dorm on hand, but most of us are not.
No. Nope. Unfortunately.
So, let's dive into a little bit of what we use, why we use it, when we use it. And, like I said, we'll probably be saying call your vet frequently throughout this episode. So.
Yeah. And another thing to preface too, the products that we're going to list are, for the most part, pretty universal, but there's a few out there that, especially that I use, that aren't well known. And probably the same for Shelby too. So if you have never heard of it, do some research. Do your own research, what's local in your area. Find products that people use around you. That'll help as well.
And also, too, understand this is what we found works for us.
Yep.
And our herd. This is not us saying, oh, this will work for everybody. This is a great solution.
Yeah.
Every horse is different. Every horse is going to have a different reaction. Every situation is different. I love diaper cream. It is my go-to for majority of things, unless the wound is, too deep. But I know there's a lot of people that would probably look at me like I'm crazy for it.
Yeah.
Even Skylar does sometimes. She's
Sometimes.
Like, do we really need diaper cream? Yeah, it'll at least help the skin and the hair.
Oh, yeah. No, it definitely does help. I've seen it work in amazing ways. But some people look at you sideways like you're using a baby product on a horse.
Yes.
They're giant babies. It works.
I have a gelding with, I'm pretty sure he has fecal water syndrome. Getting it diagnosed is pointless because there's really no treatment for it.
No.
And much like you do with a newborn foal, I smear baby oil on his butt to help with that. So, yes, human products work fantastic on horses as well. We will even say
some products.
Some. But I mean, even pads, like sanitary pads for women.
Oh, yeah.
Those work great for horses.
Oh, yeah.
It sticks right to the vet wrap. You just put it right around the wound.
Yep. And I cannot tell you how many times I have saved people from having to go to the store to get pads. I'm like, listen, do you got any at home? Yep. There you go. Use it.
Yep.
It works.
Tampons, pads,
all of it.
It's dual purpose.
Yep.
And human medications, Benadryl, Zyrtec, great for horses.
Yep. Just in higher dosage, obviously.
Yeah, I give 4 Benadryl twice a day. Usually if mine have a flare-up of something, which lately has been their eyes. I don't know.
Allergies.
It's the same eye on both horses, and I'm just like, what are you rolling in? That
Something.
both of you are doing this to the same eye at the same time.
It's horses, you never know.
Yeah, they're magical creatures, aren't they?
Yeah. Oh, yeah. Yeah, no, there's a lot that you could do to kind of help your horse that are human products. But let's get into the equine products. Some of the stuff that we use, or at least our toolkit. Stuff like iodine, or you use
Bactine. So yeah. Iodine is great for deeper wounds that typically will need wrapped or stitched. But something I use that's more of a human product than a horse product, and I actually use it for my tattoos, the first day or two after my tattoos, when they're still really fresh, I use Bactine. It is a great antiseptic. It doesn't sting like some of the other ones, and I know it works. I know so many people love Vetricin, but it seems like bleach in a bottle, and it doesn't seem to do much for me.
I've noticed that as well. Now, I don't know all the research. I haven't done all the research into it, but I personally stopped using it because I had other products that had better results for me and my horses.
Absolutely. And like if you like silver honey, it comes in 3 options. You can get a gel, an ointment, or a spray.
Yep.
So I'm either using Bactine or silver honey for my antiseptic cleanser for my more shallow, less severe wounds.
Yeah. Let's take a break for a minute and just kind of go into like our wound care process before we dive into the products. I think that'll be better. So for us, or at least for me, when I notice an injury, my first step is to assess it after cleaning it.
Always, always, always hose your wounds first. Hosing a wound cleans it out. If there is inflammation and swelling, it helps bring it down. It helps soothe the area. And, if your horse is a little sore, a little, they're tender-footed, they're a little lame, it can also help ease the pain a little bit.
Yep. Yeah. And just being able to see the wound itself in a cleaner state will help you figure out, okay, what do I need to do going forward? And that can look like a wide variety of things depending on the wound itself.
And the location.
Yes.
Location plays a huge factor.
Location is very big. I had Willie, he cut his tendon on his front leg. And at first I didn't even notice because he walked up to me normal, like nothing was going on, just nickering because he was hungry, he wanted breakfast. And I noticed that he had 4 black feet. I'm like, why do you have 4 black feet? You have white feet on some of those feet. And sure enough, it was just covered in nasty blood and dirt and everything else you could think of under the sun. And I wasn't able to actually assess everything until it was cleaned, until I could, see how deep the cut was. And it was in a spot where it was on his front leg, directly over the bone. You weren't going to be able to stitch it. And that was going to be the biggest issue. And so then that was okay, I need to reach out to my vet because this isn't something that I can handle here. It's very important to be able to assess, like, okay, this is in my ballpark, or nope, I have no idea what I'm doing. I need to get somebody who does.
Yeah, I had that baby I sold in March. She, within the first 2 weeks I had her, was throwing one of the standard baby tantrums where they believe their way is the only way. And she backed into a hook and it went up in her and sliced.
Eek. So
it didn't look super deep, but there was a flap of skin.
Yeah.
And it was already, it was clean because with babies, I always go through the entire, I'm going to completely brush you down, clean you down before we work. So she was already clean. So I could see clearly where the wound was. And to me, it looked like just a flap of skin. But I contacted my vet anyway, because whenever there's a flap of skin, it usually results in stitches.
Yes.
And the location was on her hip. There was no wrapping it.
No.
So again, I'm going to contact my vet because that's kind of out of my ballpark.
Yeah.
I can't wrap it. I can't stitch it. So, hey.
What do I do?
Yeah. Vet, help. And she stitched it. And when she did, the wound was much deeper than I initially thought because it started as a puncture and ended as that slice.
Yeah.
And when it's a puncture, call your vet.
Yeah.
They usually need to be flushed out. They usually need to be deep cleaned.
Yes.
And if it's involving metal, your vet usually wants to do a tetanus shot.
Tetanus shot, or, and like in my case with Chance, he ran into a T-post. We don't know how. We don't know why. It was a T-post that wasn't anywhere that he could have run into, so it didn't make sense at the time. But
he's very talented.
He is. He gouged a hole in his neck, and it was a long process because getting it to heal, it started to get infected, and we had to just keep flushing it, and he ended up having to go on antibiotics because we really wanted to just knock infection out of the equation, and we had to go through the vet. So
you're not going to get antibiotics through anybody else.
Nope.
And there's also different types of antibiotics. So very rarely will your vet tell you to use the same one twice.
Yeah.
Because depending on the wound, depending on the infection, if there is one, you're going to need a different antibiotic.
Yeah.
So what I used as an antibiotic for Sabine, the baby, was not the same one Valor was on. Valor was on an oral one that I had to syringe into him. which he was not a fan of by day 3, let me tell you. Having a syringe shoved in your mouth twice a day, every day for a week. I don't blame him for that.
Yeah.
But Sabine's antibiotic was more respiratory based because she had a cough. So hers was a powder that went in her feet. You've got infections for your lungs, you've got infections for your skin, you've got infections for wounds. Contact your vet.
Yeah. Yeah, and they'll be able to tell you what medication the horse needs and how to apply it. Typically, if you have questions for your vet too, of like, how can I give this to my horse? They'll tell you.
They'll give you ideas.
Yeah.
I know one that will tell you soaking a horse's foot is the dumbest thing on the planet. She will tell you all day long to poultice and wrap it.
Yeah.
And you know what? She's found that works for her.
Yep.
And you know what? Great.
Good for her.
Right. Everybody's got a different thing.
Yeah.
So yeah, this episode is, like I said, it's going to be a lot of call the vet. So it'll be like, we'll talk about something, call the vet. We'll talk about something, call the vet. So
be safe. You know, better safe than sorry.
Yeah. So back on the train of what we do. Yeah, we rinse our wounds. We clean them really well. Yep. You're cleaning the area around the wound as well.
Yes.
So nothing falls in.
Yes.
You don't want to go through 20 minutes of, cleaning the wound and, causing your horse discomfort because it's going to be uncomfortable.
Yeah.
Only for debris from the rest of the area to fall into that spot.
Yeah. No, that's the worst thing to be in. Worst position to be in.
Honestly, a safe bet, if you have the horse for it, is clean the wound, get it inspected, clean the rest of them so, there's no chance of dirt getting in there.
Yeah.
And then rinse the wound again and go back and see what you need to do.
Yeah.
So different depths, if you can comfortably stick a finger in it, if there is a flap of skin, if it's over a tendon, if you can see muscle or bone, contact your vet.
Your vet is gonna be the priority in that situation. Yeah.
But if it's not that deep, if it's not a flap of skin and there's no risk of tendon or muscle tear, then you can look into kind of what we do, which is, okay, it's not this severe.
Yep.
We'll try and handle it ourselves for the first day or so. So that means cleaning it.
Yep.
It means, drying it off so you're not trapping any water under the bandage if it needs that.
Yes, that is really important. I've noticed a lot of people don't dry the horse's wounds or like the area that they're going to be wrapping, and that can lead to a lot of other things that you don't want to mess with.
You really don't. And I mean, even if your horse is not cooperative, you can at least park them in front of a fan with a hay net for a few minutes and let it air dry.
Or clean their stall very, very well. Let them sit in their stall and eat hay if they won't stand outside.
Depending on where the wound is, yeah. If it's on their legs, you probably don't want to risk getting shavings in it.
Yep.
But if it's on their upper body...
If it's higher up and they're not going to roll, you should be okay.
Yeah. And not a lot of horses roll in their stalls. I know of some that do, but majority don't.
Yeah.
Especially if they have a smaller stall like my herd does. So, clean it off, inspect it, dry the area, and then determine, what do I need for this?
Yep.
If it's a mild abrasion where it looks like rope burn or sunburn, or they just kind of took that top layer of skin off, that's usually when I'll go in with like some Bactine as an antiseptic and then diaper cream.
Yeah.
I believe less is more with wound care. I think a lot of people put too much gunk on their horses. And it can actually inhibit the healing process.
Yeah, sometimes if you lather it up too thickly, then it's not going to heal as right.
It's not. You have to remember the skin and the wound can only absorb so much.
Yeah. And it needs to breathe.
It does.
Yes.
It does. I find some people leave wounds covered too long, or they spend too long putting stuff on it. As soon as a wound starts to scab, I try to leave it alone.
Yep.
I try to just not mess with it. I try to just let nature kind of take over from there.
Yeah. No, it's a very... I'm the same way. I do the exact same thing because it's worked for me and my horses. And
it has.
I swear by it.
I went to help somebody. They had a horse and she had decided... So we have trees here. Locusts is one name for them. I think there's another type, hawthorn. But they get giant spikes on their trunks and their branches. And by giant spikes, I mean these things could go through your hand. They are
giant
long
thorny
enough.
trees. Yeah.
Yeah. This one mare had walked under one and tore up her back. So I just kind of went to help the owner kind of figure out, is she rideable? Should they keep leaving her alone? And I took one look at it, and it was like mostly scabbed over. I was like, stop putting stuff on it. Leave it alone. You are making the healing process longer.
Yeah.
By constantly putting stuff on it.
Yeah.
Stop touching it.
Yeah. There's a point where you got to get hands off about the wound itself. Let it heal on its own.
Right. And just keep an eye on it. We're not saying ignore it.
No.
But too much cleaning, too much ointment, too much wrapping can absolutely hinder a wounds process.
Yep.
So just bear that in mind. Sometimes less is more.
Yeah. And I learned that the hard way with Willie and that tendon injury. I ended up leaving him wrapped for too long, and because of it, he now has spots on his leg where the bandaging rubbed the skin off. So his hair is never going to grow back there in those places, as much as I've tried. So it's just something that I learned the hard way through him. Now, it doesn't hinder him in any way, shape, or form, but it's more of like a cosmetic thing that you now have to look at, or other people look at.
Yeah, and you know what? That actually brings us to a great point as well. What type of wrap do we use?
Yeah.
My big two are either vet wraps or standing wraps.
Yep.
So for wounds that take up, either the length of the cannon bone, or for wounds that I know are going to be a process to heal, I usually start with standing wraps.
Yeah.
It's soft, it's non-irritating. It's, yes, it's more work to clean, but it's not going to be as tight. It's a lot more comfortable for them to have on.
Yeah.
And, it does cover a greater area, so it can help keep it clean. Even if it comes loose, the likelihood of stuff getting in it's less.
Yeah.
And again, if your horse is wearing it for a long period of time, like Skylar said, Willie was wrapped too long. Standing wraps aren't abrasive like vet wrap can be.
No,
it's not irritating to the skin like vet wrap can be.
Because it's typically made from like a fleece material, so it's a very soft bandage in itself.
Yeah, I usually start with standing wraps, and then as the wound gets smaller, as it starts closing up, as the skin's less sensitive, I'll transition over to vet wraps. But vet wraps, it's very easy to wrap them too tightly. Some horses' skin, if you don't get the gauze roll perfectly placed, some horses' skin is super sensitive to that.
Yeah.
So those are all things to bear in mind when you're wrapping a wound too.
Yep. Yeah, and my first go-to is vet wrap because I now know how to wrap it properly. I feel like for me and how I do everything, it's more secure and it's not going to let anything in.
Well, and that's also the thing.
It's preference.
If I'm turning my horses out, a standing wrap's not going to stay on. So Skylar's horses are on almost 24/7 turnout. She doesn't really bring them in very much unless it's severe weather. So yeah, vet wrap, if they're out almost 24/7, if you know they're going to still be moving around and doing stuff and acting a fool, vet wrap stays on.
Yep.
It will not budge. But I always like to leave my horses in if they do need wrapped for at least a day, to monitor swelling, to see once the adrenaline comes down if there is lameness.
Yeah.
And that's when I standing wrap. Standing wraps are great for stall rest, vet wrap for turnout.
Well, I will say standing wraps are good for horses that don't lay down and roll.
You mean every horse in my barn, so I just accept the filth as a factor?
Yeah. When I was trying to get Willie's leg to heal for that tendon injury, we kept running into the issue of when I ended up putting standing wraps on him, he would get them off and, whenever he rolled or laid down in a stall, which he does every night.
So that tells me you probably didn't have them tight enough either, though.
Possibly.
I've had horses lay down with standing wraps. I've had them roll with standing wraps, and they usually stay on. They might loosen a little bit, but they usually stay on unless the horse pulls them off.
Well, and that's the thing. He is a puller. He definitely does pull. He even pulled off the vet wrap. So
he didn't want it touching him.
No. He was very much just let it breathe. And I should have listened to him, honestly, because eventually that's what I ended up doing, and it worked way better.
Hindsight's always 20/20, though.
Yep.
That's the thing, though. If you do have a horse that has a wound and it's the first week and it has to stay wrapped, they do make things where horses can't put their heads around to pull it off.
Yeah.
It looks like a cage, And yes, it will limit their activities, but it will force them to keep the bandage on.
Yeah.
So
unfortunately, yeah, but it's one of those necessary steps, especially if you have a horse that will not leave a wound,
alone.
be.
Yeah.
It's just a necessary evil.
Just
kind of like a cone of shame.
Yeah, it
dogs
really
and
is.
cats. There you go.
There's not a whole lot of difference between them.
No.
Some dogs are great patients, and then some are like mine, where they're just pathetic nightmares. And horses are the same way.
Yep.
You get some, like Valor, if you want to wrap his wound, put his butt in the corner, give him a bale of hay, and you can do whatever you want to the wound. I've got another one that she just dances herself into a tizzy over a wound. So it's just horse dependent.
Yeah.
Everything is horse dependent. So, yep, we, contact your vet. If you don't know, if you feel like you're out of your depth, contact the vet.
Yeah.
Clean it, keep it clean. If it needs wrapped, wrap it. Remember, less is more.
Yep.
So now, I think this is a good time to kind of just list some of the products we use and why.
Yeah.
And why we don't use other products that are more popular and more well known. Just so you guys kind of, for the people that don't have, 1,000 people to lean on or, years of experience, this part of the episode is probably going to be more for the newer horse owners.
Yes.
The more novice people. So, go ahead and if you want to listen to our products that we use, go for it. If you're like, I've gotten the information I need.
Thanks for listening so
far. But yeah, this is going to be more for the more novice people.
Yeah.
So when you're looking at wraps, let's start there because we've talked about standing wraps, vet wrap, and gauze. So when you're using vet wrap, do not ever apply vet wrap directly to the skin if you can avoid it.
No.
That is usually where you will wind up with a lot of
complications.
rubbing, skin sensitivities. And make sure your vet wrap is never in direct contact with the wound.
Yeah.
That is probably the biggest thing. Yeah.
That's even worse.
Vet wrap is very abrasive, and the natural movement of a horse's body and skin and muscles will cause that vet wrap to rub and irritate and aggravate and potentially reopen.
Imagine putting a piece of sandpaper directly on the wound, and anytime the horse moves, that sandpaper moves. So that's basically what you're doing if you put vet wrap directly on the wound itself.
So, big thing, get yourself some good cotton rolls.
Yes.
Cotton gauze rolls.
Yes.
And we're specifying cotton. It is soft.
Yep.
It is
natural.
It is natural. It's not going to hold infection. It's not going to irritate, and it will break.
Yes. It'll rip apart, and you can make it smaller if need be.
If need be, yeah.
Yeah.
So get yourself some nonstick cotton gauze rolls. Get yourself some nonstick pads, and they may still stick. Some wounds just happen to ooze and seep
and get crusty.
Yeah. So be ready to always have nonstick pads, but be ready that they may stick, and you might have to use a little bit of water and kind of dab the area and slowly ease it off.
Yes. I noticed that a lot with Willie's leg injury, that it got really ugly and nasty, and everything would stick to it, including the cotton. And so I had to just very carefully just rinse it with water each time that I was going to rebandage and just clean it out from the beginning.
Yeah. And then you have your vet wrap. So here's the thing. When you're ordering vet wrap online, because I found that is the most cost efficient way to do it.
Yes.
I can get like a 48 pack for like $20-30 on Amazon.
Yep.
Always make sure you're getting the 3-inch rolls.
Yes.
1 and 2 inch is going to be too small for majority of what you're doing.
Yep.
And 4-inch, yes, it can be helpful, but it might also be too big.
Yeah.
3-inch is kind of like your sweet spot.
Your perfect medium.
Yeah.
Yeah.
And you know what? Be prepared. You're probably going to go through 2 or 3 rolls for one wound.
Oh, yeah.
It is entirely likely, depending on the size.
Yeah. Vet wrap is, I found when you buy it through stores, it's typically more expensive than going through online. So,
it is, and you don't get as much.
Yes. Online is definitely what I recommend. Amazon specifically, they have so many different like off-brand vet wraps.
I get all my bandaging stuff on Amazon.
Yeah.
Because this is one thing we will tell you as a newer horse owner. If they can slap Equine on it, they will upcharge it.
Yes.
So my cotton gauze rolls, my non-stick pads, are all the same things you would find in a Walgreens.
Yep. And they're made for people more than anything.
Yeah.
But it's the same exact product. It just has a different name.
Mm-hmm. It's the same exact product. It just isn't upcharged or any of that.
Yep.
So, order online and don't go for something just because it says Equine.
No.
More often than not, slapping Equine on the label is just a way for them to increase the price.
Yes. Like, I get a pack of 50 rolls, and that's like $40.
Right, yeah. See,
it's super cheap. Where then, if I were to go and buy 50 rolls from the store, they would be about...
It would probably be
like
twice that
$1.50
yeah.
each. That's the cheapest I've ever seen vet wrap. So...
Oh, the cheapest I've ever seen, it's like $3. Yeah. And I'm like, no, thank you.
Yeah. Yeah, so... It gets expensive quick. So online ordering is probably going to be your best bet for that. It's just better.
And then if you do always keep standing wraps and quilts on hand.
Yep.
Always, always, always. You never know when you're going to need them. And when you need them and don't have them.
No, when you say quilts, explain that.
So standing wraps are similar to polo wraps. It is, but it's a different kind of fabric. Polo wraps are typically felt. Standing wraps are typically some kind of smooth nylon. You would know the fabric better than I would. And then quilts are the white piece of fabric that goes under the standing wraps. That is what's directly against the skin, directly against the wound, directly against all of that.
Yes.
So
it's just another layer of padding.
It is. And I usually, when I wrap wounds with standing wraps, I usually do my gauze pads, my gauze rolls. And then I do the quilts on top. You wrap the quilts and then you put the standing wraps on top to hold everything in place.
Yes.
And when you do it that way, yes, your horse is going to be more comfortable. Yes, they're going to have a little bit more support if they are sore in that leg.
Mm-hmm.
The compression absolutely helps blood flow.
Yes.
But if you do that route, be prepared to wash those every single day.
Yes, you will have to wash the bandages because they will get sweaty, they will get dirty. And if you put a dirty bandage on a wound, that's not going to help.
It's not. And like we said, sometimes wounds ooze.
Yes.
Honestly, you want your wound to ooze and eke just a little bit.
That means that the healing process is happening.
And it's pushing out any infection or debris. So if you do standing wraps, again, I like them. I think they're fantastic. But if your horse is on turnout, yes, the vet wrap is the better option.
Yep.
But when you have standing wraps, make sure you have at least 4 quilts and 4 wraps on hand.
Yes, to alternate between.
Yep. And so, you're not trying to wash them every day. I know some of us, have 20,000 jobs on top of caring for our horses.
Yep.
And doing laundry every single day isn't feasible.
No.
Especially because I will tell you, you're gonna want to rinse your standing wraps and quilts before you put them in the washing machine.
Yeah, they're gonna be a little nasty.
Just a little nasty, a little smelly. You want to rinse them out first or your whole house is gonna smell like that.
Yeah.
So that's kind of how we start with wrapping wounds. Our choices of antiseptics to clean wounds, if it's something super, super mild, scrapes, it's not super deep or super major, I usually use Bactine. Yep. Or Silver Honey has a spray now that I'll use.
Yeah.
You can also use Blue Coat. It's an antiseptic, but it's also a wound coater, so it'll cover it, keep flies off.
Yeah.
Scarlet Oil and Blue Coat are roughly the same thing.
Pretty much. Yeah.
Yeah.
They just stain different colors.
They do. I had Blue Coat all over my hands for like 3 days. It did not go away.
Yeah.
So those are kind of your antiseptics: is iodine, Bactine, Blue Coat, Scarlet Oil. Those are great. And like
something that I use personally too for just like anything from really deep to minor is called Well Horse. Now it is a resin based, like almost like a liquid bandage in sort, and it also serves as an antiseptic, which is why I really like it. So I can use that underneath of like a bandage to help clean and keep from getting infected.
Yeah, like we said, less is more.
Yep.
So as much as I don't like all the chemicals in something like Blue Coat, I also acknowledge it is one of the best wound things out there.
Oh yeah.
Silver Honey, now that it's becoming more popular, has been phenomenal because it is an antiseptic.
Yeah.
But it's also a great wound coater.
Yeah, silver honey, Manuka honey, whichever you call it. Yeah.
Either or. I mean, silver honey, I think, is more the brand name. The main ingredient's Manuka honey.
Yep.
But yeah, less is more. So Well Horse, Blue Coat, Scarlet Oil, you know, Bacti and iodine are great to clean the wounds, but if you just want to do it in one go, those 3 are great options.
Yep.
Then, you know, there's other ointments that Skylar and I don't really use. Corona, Furazone. They're not bad products, but we have found the others that we use to work significantly better.
Yes.
And they don't leave quite the same residue.
Yeah, and I would also include Vetricin on that list too.
I don't like honestly, I'm not gonna lie, this might be the wrong thing to say here, but I don't consider Vetricin a proper wound care.
I don't either.
That's
my personal opinion.
Yeah, like we said, this is just us listing out products you guys can use and what we use and don't use and why. Because if you're a newer horse owner, sometimes it helps to have a list of things to choose from.
Yeah.
A list of things to look into for yourself.
Well, and I've noticed Vetricin is everywhere. And they have all these different products, but I've never found them to work in any situation that I've applied it.
I haven't either. I mean, the things I have found to work the best.
Yeah.
And is Bactine and Silver Honey. The more I use Silver Honey, the more I love it because it is so great for the skin. If it's, you know, your horse took a chunk of flesh off, it reduces the scarring and improves the hair growth immensely.
Oh, yeah.
I honestly, Valor, like, he still has bald spots down his back leg from where he had those stitches and those injuries. And I wish when he had those injuries, I knew about Silver Honey.
That's how I feel about Willie's injury because I could have maybe helped him have the hair grow back.
Right. And that's all we do here is we take our experiences and we give them to you guys so you can extrapolate what you need to.
Yeah. Hopefully you can learn from our mistakes and what we had to learn the hard way.
Yeah. Like, part of the reason I don't like Furazone is it's very wet.
It's very wet and it also gets very abrasive, I've noticed.
It tends to leave, it can burn.
Yeah.
It can leave like a chemical burn. So when I have used Furazone, I don't use it on open wounds. I've used it on an open wound once, but the reason I did that was it was on the heel bulb. And that area you kind of need something a little stronger anyway because it's constantly in contact with the ground.
Yeah.
And I didn't know what the cause of the wound was. So I was still kind of new to handling those things, so I just threw some Furazone in it because Furazone will kill everything.
Yeah.
But it will kill healthy tissue too.
Yes.
So that is a big reason why I don't use it anymore. Plus, like I said, it's really wet.
Yeah.
So if you're trying to dry something out, Furazone isn't going to help you.
No, it's just going to make it worse.
Yeah. And like we said, it can burn and kill off the healthy tissue as well.
Yeah. And you know what? Something we didn't really touch base on, and it's a little bit more if it happens. So Willie and his tendon injury specifically, I know I keep circling back to that, but that was my biggest learning experience dealing with that wound. He actually got proud flesh from that. And if those of you who don't know, proud flesh is basically where the skin is growing at such a rapid rate that it's overgrowing the wound itself. And it's actually harming the skin and the wound. So you end up having to scrape it off. Now, the proud flesh, it unfortunately has a lot of blood vessels in it and everything, so it bleeds a lot, but it doesn't have any nerve endings, so the horse can't really feel what you're doing. Thank goodness. But something that I found with him and getting that proud flesh, Well Horse worked so well.
See, and that's the thing. Everybody totes Furazone to deal with proud flesh, but I find you can avoid proud flesh by first leaving the wound alone. But two, if it does develop, because certain areas, like where Willie's was, are more prone to developing it than others, having something in place to help prevent that.
Yes.
So that's where, like Skylar said, Well Horse comes into play.
I love it.
and it's not a wet product.
No.
It doesn't leave the wound moist.
No, and it dries, honestly, within a couple of seconds of application.
One of the first trips we took up to Hocking Hills together, who was it? Chance that nicked the crap out of himself?
Yeah.
Or was it, I can't remember, it was one of your two.
It was Chance, yeah.
He nicked the crap out of himself, and so Skylar put the Well Horse on it, and Yeah, it made the wound look worse than it was because
it's red.
It is
so it's,
red.
It's a dragon's blood resin base.
Yeah.
So it's red. It will dye red.
And Chance is a buckskin, so
yeah. Everybody kept coming up like, "Is your horse okay? He's cut. He's bleeding." No, it's the wound care stuff. Yep. Don't worry.
But by the time we left, you couldn't even.
No, you couldn't tell.
No. So yeah, the well horse is fantastic for that. Another really popular one you'll see is Corona.
Yes.
Now, I have used Corona. I would still use it depending on the wound.
Yeah.
But it is no longer my go-to because, again, it's wet. It can cause irritation.
Yep.
And it doesn't seem to, as a antiseptic wound ointment, as a healing booster, as a skin helper, it doesn't seem to do much in that regard.
Yeah, I'm kind of in the same boat too. I understand its importance in certain applications, but for the most part, I don't use it because I don't need that circumstance. I don't have situations that need it.
Yeah, and we're definitely still playing the less is more game.
Yep.
So when you have horses, you're always experimenting.
Yeah.
And Skylar and I recently met somebody on our trip that gave us some food for thought in terms of how we approach wound care.
Yeah.
And both of us have we have made our wound care process. We have made the ointments we carry as our first aid. We've shrunk it down to a handful.
Oh, yeah.
We probably carry more vet wrap and pads than we do ointments.
Yeah, 100%.
Because between the two of us, we take our wraps, we take our pads, we have a bottle of Bactine, a bottle of iodine, and then usually some Well Horse and Silver Honey, and that is it.
That's it. That's what we use
for
for
products
our rides
total.
And everything. Yeah.
4 products total. That's all. And we have found that it covers majority of things.
Yep.
Now, I will keep Blue Coat on hand because, like I said, if you do have a wound and you want just a quick, super fast cover for it that flies don't want to touch, Blue Coat does do wonders for that.
Well, let's talk about that a little deeper. What do we do for around the wounds? How do you keep flies off?
Because you can't always wrap them.
No.
If it's on their butt or their hip or their tail, you can't wrap them.
Now, I have heard there is a company that's testing horse bandages that applies to the horse hair. So for wounds on the butt or areas that you can't wrap, there are products being made. I don't know how well they work. I have not tested them personally, but something to think about too.
And something else to think about too is I'm actually going to be, fingers crossed, obviously we do not want our horses injured.
No.
We don't want that stress. We don't want it.
Nope.
But the next thing I will do, because I have one that injures herself on a regular basis, I swear this thing breathes and bleeds at the same time. So with her, it's just a matter of when she's going to do it. She is my testing dummy at this point for products. I am going to be adding pine tar into my wound care. And I mean 100% pure pine tar. Nothing else in it. Yeah. No other products. And I'm not going to be putting it directly on the wound. I will put it around the wound and see how well that works to A, keep flies off of, but B, see if it can help a gauze pad stick.
Yeah.
Because tar is sticky. It's really sticky.
Yeah.
It doesn't come off.
No.
But, SWAT for certain wounds is also safe.
Yeah.
I wouldn't put SWAT on deep wounds.
Or directly to the wound itself.
Yeah.
But around the area to help keep flies off. Yeah.
Yeah, it'd be a good choice.
And personally, too, in the past, I've always just used fly spray, and I'll put it on a sponge and wipe the area around, too. But that's the exact same thing as SWAT.
The thing I found with SWAT is it stays better.
It does. And it lasts a little bit longer.
It does. I've got horses who have had SWAT on for 3 days now.
Yeah.
So, that's kind of our wound care. We know this episode was a lot of call your vet, but understand your limits.
Yep.
Understand what you can and cannot handle, and don't hesitate to call the vet.
Yeah. Don't be afraid to reach out to get help, because it's going to save you and your horse down the line.
And understand this too. You're still learning. We all are.
Oh, yeah.
And if you are a worrywart of a horse owner, and you're contacting your vet over everything, make sure you have a vet patient enough to walk you through and teach you.
Yeah.
Not every vet is patient enough to teach new horse owners.
No.
And you know what? We need all kinds.
Yeah.
You know, those vets that are more like, come on, just figure it out. It's not that deep. You know, you got this. More experienced horse owners, that vet is perfect.
Oh, yeah.
Because they know.
I would die for a vet like that, which
Right.
I do have a vet like that.
Yeah.
So.
We have a great vet.
Yeah.
As a newer horse owner than Skylar is, you know, having Heather has been fantastic because she is just the right amount of objective, but also very compassionate and understanding.
Yes.
But I also have seen her when she needs to just be objective, and she can be very, very well.
Oh, yeah. She'll tell you straight up what's going on, what she personally thinks. But
and
it's
then
typically a
ultimately
case of you have
leaves
to
it
ask
to you.
her. Yeah.
She will ultimately leave it to you.
Yep.
So, yep. Call your vet if you don't know.
Yeah. That's pretty much it. So we hoped you enjoyed this longer episode.
Yep.
But again, it's very important.
It's a very important episode, and we want to make sure you guys have all the information. And, you know, while we do want to appeal to all levels of expertise, we do want to make sure we also are providing for our novices.
Yep.
So,
yeah. So we hope you enjoyed it, and we look forward to seeing you next week.
We hope you enjoyed this week's topic. Join us for new episodes every Sunday. And to keep up with the herd, be sure to follow us on Instagram at The Highline Herd and visit our website at thehighlineherd.com. We hope you enjoy the show. See you next week.